Qualified, professional, and compassionate doctors talking real solutions to real health problems.
The month of September, we celebrate the efforts taken against sickle cell disease. Yes, the month of September is Sickle Cell Anemia Month. And with me in studio, I'm pleased to host two great individuals who are leading the fight against this dreadful disease, sickle cell anemia. On the far end is, we're pleased to host Dr. Kasirye Philip, a senior pediatrician and hematologist with Mulago National Referral Hospital, and the head of the sickle cell clinic at the hospital. Welcome to the show,
Thank you.
Dr. Philip.
Thank you,
Yes,
Dr.
glad
Aaron.
to have you back.
Thank you, Doctor.
Yes.
And hello, viewers.
Yes, I'm sure the viewers will be very excited to hear from you again from last time when we talked about the sickle cell anemia. And now on my immediate left is a lady who is the executive director of the Uganda Sickle Cell Rescue Foundation. She's going to tell us a lot more about what the foundation is doing to help people living with sickle cell. Most welcome to the show.
Thank you.
Ms. Nagawa Tracy.
Thank you, Aaron. Thank you. It's
Yes,
a pleasure to be here.
Pleasure to meet you. And I am your host for today, Dr. Dara Sowachi. So, without wasting much time, let's understand more about sickle cell disease, but specifically what Ms. Tracy's organization does. So, Tracy, could you tell us more about the Rescue Foundation of sickle cell, sickle cell anemia? What is it about?
This organization, Uganda Sickle Cell Rescue Foundation, was formed in 2013 by one Dr. Blaim Wangachivilige, aka BMK, and one Major Lukia Mlumba. She's a US. She's in the U.S. Army in the United States. She's called Major Lukia Mlumba. So later on, we are joined by Roofings, Lalani, Skanda, if you know him, and AGT Group is an agricultural company. So those are the four directors of this company, of this organization. Sorry, the ones that came together and realized that there is a danger in Uganda that needs to be tackled. Two of them have sickle cell children. Major Lukia Mlumba had a sickle cell child. But she had a bone marrow transplant. Now she's okay. So is Dr. Skanda Lalani as well. He has sickle cell children, but they're all undergoing bone marrow transplants. So that's the spirit. But BMK has no, he has no child, but he's just passionate. He's giving back to society. He's just
so the inspiration comes against the background of people who have either their children have had sickle cell or they know someone who has had sickle cell.
Yes. But
so what is the goal of the foundation generally? Because when you hear it, it sounds a rescue foundation. It's like a rescuing from danger, what exactly does it do?
The rescue part is we are trying to help the public understand sickle cell or get to know sickle cell before they go into marriage. So you kind of rescue them from going into the situation. So our major objective or major goal is to test and screen for sickle cell, and we do it free of charge. So that the public gets to know their statuses or their genotype. It's called a genotype before they go into marriage.
The details about sickle cell.
Yeah, of course.
So maybe Dr. Phil, to engage a bit. The foundation is supporting, I think it's supporting people living with sickle cell or families whose children have sickle cell.
Let's say families, because it's a whole entity. You don't have to go with only the child, you go with the whole family, because it's a whole different level of understanding sickle cell and living with it as a family and as a sickle cell patient as well. So we go with the family. Yeah, we do really help the family.
Okay, so just to give the viewers a bit of context, because people may not know what we're talking about. We're saying foundation, sickle cell, they're like, what is sickle cell? Yeah? So Dr. Philip, what is this sickle cell we are talking about, whose Tracy's organization is helping to support?
Okay.
Yes.
Maybe just a little bit, in addition to what Madam Tracy has mentioned, the burden of the problem of sickle cell concerns all of us. And that's why the Ministry of Health opened doors to work with those other non-government organizations and everyone out there to increase awareness and therefore contribute towards the efforts to fight, to work to prevent or reduce the burden of sickle cell in Uganda.
Okay.
And that's where this organization come in. Okay.
So it's a collaboration between
Yes.
NGOs and then the government
Yes.
for a common goal of preventing sickle cell.
Perfect.
Okay.
So going to the subject of sickle cell is actually a genetic disease. Meaning,
spoken some big words there. Yes.
meaning
so what
that,
do you mean by genetic disease?
it's a disease people are born with as an part of them, an integral part of them. You know, those small building blocks called genes are what actually determine who we are.
And where do the genes come from now?
And we get those small building blocks from our parents.
Okay.
Okay? So we get part of the building blocks from the mother and the other from the father. So sickle cell happens to be one of those diseases that are passed on in that mode, using that mode.
It is not like malaria where you know the
No,
mosquitoes will come or the
absolutely no.
typhoids. No?
Yeah.
For it,
And
it's a genetic thing. So I mean it comes in families, it moves in families.
perfect.
Okay.
And therefore, people with sickle cell disease are actually born with it. And specifically, they are born with an abnormality in their red blood cells. Ordinarily, what makes the blood appear red is a pigment called hemoglobin.
Okay,
So
deep inside the blood.
Exactly.
Yeah, that red color of the blood.
Yes.
Okay.
So it's made by a pigment called hemoglobin, which is contained in round cells called red blood cells. And it helps to transport oxygen, which is the facilitates us to live, the breath of life, from the lungs to the different parts of the body for the body to function normally. So people with sickle cell disease have a change that occurred or was passed on by the genes from the different parents to this child. And they create a scenario whereby this child has some changes which are abnormal in the way those red blood cells function.
Very interesting.
Yes.
So I think in summary you're saying some components which are in the form of genes come from one half from the mother, one half from the father. They combine and make the child, but that child will have the genetic makeup, which is I think combination of the parents' genes.
Yeah, true.
Yes.
Yes,
Yeah, true.
is what will equal the sickle cell. So if the parents have, I think they call them traits. Is that the word is still there?
Yes, it's
traits,
still there.
eh? Like having half normal genes and half
For sickle cell?
genes. Let's say sick genes in a way.
Okay.
So if so how a child with sickle cell comes about is if the child gets can you say sick gene? Is that
The
correct?
sick
Medically
gene or
correct?
the part that has sickle cell from the father
Okay.
and another that has
So
sickle
the
cell
child
from the
gets
mother.
both genes.
Yes, please.
The sick one from the father, sick
And-
one from the mother.
yeah.
They combine two, then that's
Exactly.
sickle cell.
Perfect.
All right. So it seems to be something that children can't do. You know, they're just born like that. So
course.
how is the foundation supporting such children? Let alone all the challenges of which the children face, which I want to discuss much later in the show. But maybe specifically, why do we celebrate September? What is the role of the foundation in supporting sickle cell?
Okay, there are two questions involved. Why
Yes.
September?
Yes, why September?
September is not, there's nothing specific about September. It's just like you want to.
Is it the S because it's S?
No, really, I don't think that's what the ministry meant. But we just want to remind people every time, you know what, there is sickle cell. Please wake up. It's like a wake-up call. If it was supposed to be the whole year to always talk about sickle cell, we would have it. We will do it. But you know, we're having specific months. We had the Kabaka run, remember?
Yes, I remember.
That is in April. Yeah, for 3 months. That
this
is
year it didn't take
No, it
place.
was he gave us. You know, Kabaka's birthday. They give you a chance for 3 years. So we ran for 3 years.
Okay.
Yeah. Then there is the World Sickle Cell Day, where the world is celebrating sickle cell warriors. We call them warriors. You don't want to call them sicklers because it's stigmatizing. You know, you don't want to, like, you have whooping cough, or someone tells you whooping cough, kafuba. It's stigmatizing. But when we give them a name that like gives them power, and they feel like, yes, I have sickle cell, but yes, I'm a warrior. I'm fighting. There's something I'm fighting. It's not going anywhere. It's staying with me. So I'm fighting with it. So I'm a warrior. You know, that's the word. That's why we call them warriors. And then there is the Sickle Cell Awareness Month. This is the Sickle Cell Awareness. We've been doing September.
Yes, it's the awareness month.
It doesn't mean we are arresting all the other months. No, but we enforce. The armies, the noise is too much. That's why I'm here on the doc show. That's why Dr. Kasri is here. That's why everybody else in the sickle cell advocacy is out there making noise like, hello, sickle cell is still there. Yes, despite the COVID, yes, we have COVID, yes. This is the noise now running. Actually, this is the perfect time. People are, every focus is on COVID. But then you are making them realize, hello, sickle cell is not going anywhere.
I totally agree with you. Yes, the COVID has temporarily taken attention away from everything.
Yes,
but there are still so many diseases
that are actually still existing. And
cancer, pressure, you name it, even malaria, a number of diseases. So we are glad that your organization and Dr. Kasiri and the whole medical fraternity is coming up to raise the awareness about sickle cell disease. If you don't know what sickle cell disease is, please stay tuned. We are discussing it in depth in this show. What exactly causes it? Is it that if someone has sickle cell, can they pass it on to maybe their friend by sharing cups? Oh, they know those common questions. People have very interesting ideas and understandings about sickle cell. So don't go. We'll be right back after the break. If you have any question regarding sickle cell, please forward it to our social media platforms. We'll be happy to respond to you. In the meantime, please stay tuned. We'll be right back.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Welcome back. The month of September is the month where we create awareness about sickle cell disease or sickle cell anemia. In case you don't know what this is a type of disease that affects the red blood cells in your body. The red blood cells contain that element, that pigment, which gives the color red. That's your blood being red, not for other reasons. So as regards sickle cell, people might be having questions specifically about its transmission, how exactly it's acquired, and who might be at risk of getting sickle cell. Well, our experts in studio are here to tell us more about that. So I guess that goes to you, Dr. Kasiri, being the expert in sickle cell disease. What are there risk factors, things that can, like for example, if let's say you drink this substance, a herbal product, can they get sickle cell? People might have such questions.
Thank you very much.
Who is at risk of getting it?
Thank you very much, Dr. Darius. Like earlier said, sickle cell is really passed on through genes, which we earlier explained, from parents to their children, offsprings.
Could it be like the parents did something that made the genes now bad?
Yeah, no. It's just these genes are passed on from generations to generations.
Okay.
Many times, some of these genes or those building blocks that describe who we are, determine who we are passed on silently, and you may not get to know them apart from some situations. And the situation in which sickle cell manifests as a disease in children is when they acquire one of the gene for sickle cell from the mother and another from the father. In that case, they are born with the two genes for sickle cell.
So children everyone is always born with the two genes for, let's say, it's the red blood cells in this case?
Yes.
So if so a child can never be born with one gene. In other words.
No.
They're always born with two.
Oh,
No.
yes.
even for the normal, all children actually
You need to
are
come
a
from
product
mommy
of the
and
mother
yeah,
and
mother
the father.
and father.
Yes.
And with regard to that red pigment we talked about, hemoglobin, the makeup of that hemoglobin, part of it comes from the mother and part comes
So
from the
either way, there's
father.
no way you can escape.
There's
have to
no
be
way
born.
you can escape, and the fact that you are born with either sickle cell disease or no sickle cell disease. So the normal person, scientifically, the normal red pigment is represented by the capital letter A, and so that person would have, a normal person would have two A's, one from the
For the
mother,
two
one
genes.
from
Okay.
for the two genes. The child who has, or a person who has sickle cell disease would actually have the two genes being abnormal, and they are represented by the letter S, capital S. So they acquire one from the mother and one from the
So
father.
one S from the mother, one S from the father.
Yes, perfect.
Equals sickle cell.
Equals to sickle cell. If a person acquires one S, which is the abnormal, and then the one A, which is normal, that person is called a carrier or
carrier.
trait.
But they're not sick, is it?
Ordinarily, they would not appear as sick, or they would not present with the typical signs of sickle cell disease. They could be like any one of us here, seated here. And that's why I say that some of these diseases are passed on with silent genes. They only manifest as a disease when they are in duplicate in this individual.
Okay, that is, I think that is pretty much very
Yes.
clear and understood.
And that actually explains that it is not something you can acquire from associating closely or drinking through something or being bewitched. So it is something that you are born with by the fact that your parents had these sickle cell genes, and therefore the child is born with two sickle cell genes,
I think
one
we
from
should
the
also
mother and one from the father.
should also remind people, it's also not the parents' fault that they had these genes.
Oh, no,
Perfect.
it's
It
not.
came from generations in the past, their ancestors. So
Perfect.
how the abnormal genes came to be about, no one really knows.
Yeah.
Just the way people are. So we shouldn't stigmatize people and say that no, this one has sickle cell and this one doesn't. Which brings me now to the role of the foundation. Are there specific challenges that the warriors, children who are living with sickle cell, are there challenges that they are facing that you, the organization, are coming to support?
Yeah, of course. I'm not even talking about the family, the sickle cell, the family at large. Yes, the warriors have their, sometimes the warriors' depression is caused by the family.
Okay.
Sometimes sometimes the family's depression is caused by society. So this is not a small thing. It's a whole big topic of depression, because society has its contribution, family has its contribution. But let me focus on the warriors right now.
Yes.
The warriors, the fact that you grow up knowing that I have sickle cell. First of all, the society sees you as how can I say it? Sees you as a thank
There's
you,
a lot
an
of- a bit of
outcast. Thank you.
stigma
They see,
around it,
they see
yes.
an out, like some warriors, like the physique really shows that you're actually not normal. The yellowing of the eyes, that's the jaundice. Sometimes they get, maybe the stomach is swollen, maybe sometimes
They're
they're
always
too
getting
skinny.
attacks of
So
pains and-
already the society is seeing you as you're not normal. There's something wrong with you. There's always that picture. So you grow up in a society where everybody looks at you as you cannot do anything.
But is that true?
No, it's not true. That's why I'm here to let the public know it's not true. We have warriors that have walked miles, that have flown like Vading, and they are out there doing work.
Wow,
So
that's amazing, yes.
so they have challenge, because if the society does not believe in them, remember, if society doesn't believe in you, most people do not believe. You feel like everybody doesn't think I can actually do this, so they lay back. And they feel like they need to be given or they need to be taken care of all the time. But then we need to encourage them, let them understand that they're normal people. Yes, this disease is part of them. It's not going away right now. Yes, there's a challenge. It can go away with the bone marrow, but now I'm talking about the fact that
So
that it's not going. It's not going away. It's going to live with me. The society needs to help them learn how to live with the disease. When a warrior comes and says, I can do that, they can wash, they can iron, they can get jobs, they can
be CEOs, they can be teachers,
thank
doctors.
You. So parents, the parents themselves need to let the kids also go to school because they are normal kids. You know, the work. So we as an organization, first of all, like the family itself, like gives up on the child. Okay. Most times when they come to office, maybe because we do sickle cell testing. So this is the journey of our when you come, we want to test. Let me see now if family already has a child, and this child is already presenting like symptoms of sickle cell disease, and then we test them. We get to find, okay, now your child has sickle cell. Now that's where the journey begins with us as a family, as a warrior. So we need to help you understand. When we start with because most time these kids are kids. So you let the parents understand the disease so that they can be able to raise the child. You understand? So you start
so that child
helping them.
still be able to go to school.
To school, you help them how to manage. Please do this, don't do this. Go see doctor. We actually go. I think Dr. Kassi has received a lot of patients from our organization. Please go see Dr. Kassi. He's going to help you with the treatment plan. So you help them understand the disease and live normal so that they are able to take care of the child so that they are raised as normal human beings.
Okay.
So
you bring out a very important point. Why they should seek help when they have sickle cell. You know, I think because of the stigma around it, some parents who want to hide the child away.
Course.
Like in the home, they don't even go to school. They're like, no, this one is sick. Let us stay at home.
Yeah,
so why is it important that families should take their children to the experts, to the doctors?
Give them to the world to understand.
Yes, the warriors. Why should they go to the hospital?
Why are parents supposed to take their kids? This is a chronic disease. You cannot treat it yourself. You need an expert to help you understand the disease. Okay. So if you keep this child that's why there's an issue of dying before the age of 5. They die early. Why? Because parents are hiding them, and this kid is not getting the proper diagnosis or the proper kind of treatment to help. Thank you. Yes. So we encourage them, please, you go see the doctor so that they help you understand the disease and also give you a treatment plan so that this child lives as normal as they can.
And yes. Dr. Kassi, I think they can, is there any limit to how long they can live?
No, there's no limit. They can grow into very productive adults. And
all the way up to old age?
Yes, sir.
Okay, so I think you've heard it from the experts. If you have someone who has sickle cell or has just recently been told they have sickle cell, that is not the end of the journey. Please reach out to these experts, reach out to the Uganda Sickle Cell Rescue Foundation, reach out to your doctor, and they can link you up to the experts who manage sickle cell. That is not the end of the journey. These people can grow up to live into full adults, into productive citizens of the country and doing great things in their lives. So you shouldn't lock the child in your home just because they keep falling sick, they keep getting these problems. So I'll talk a bit more about this, how to identify sickle cell disease. But in a nutshell, people with sickle cell, or the warriors, as you call it,
yes.
Ms. Tracy,
yeah.
The warriors are just like any other person. They can grow up to be wonderful human beings and contribute a lot to our society. So therefore, we should take great care of them and not stigmatize and raise problems. We'll be right back to talk more about the sickle cell, how we can support the children, what exactly we can do, and if there are any tips to prevent, we should also highlight a bit of that. Okay. So we'll be right back after the break. Don't go away. If you have any questions, send it to our social media platforms. We'll be happy to respond to each and every one of them. Don't go away. We'll be right back.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Sickle cell can be a problematic disease and very challenging, especially for parents, to be able to recognize that their child might be having the disease. So how exactly can we tell the two? Let's ask our expert in the studio, senior hematologist. The hematologist, by the way, is a doctor who specializes in blood diseases or which sickle cell happens to be one of those diseases, because it's a disease which attacks the hemoglobin. That's the pigment that gives blood the red color, and therefore it's this field of expertise. So, Dr. Kasiri,
yes,
how can a parent know that their child might be having sickle cell?
Thank you very much. So, ordinarily we begin with what we call a history. Usually, the parents, either both or one, has ever heard about the sickle cell disease, or has ever had a relative with sickle cell disease in their family.
Okay. Like
And
there'll be
so
a family
history of sickle cell disease somewhere.
Okay.
That should raise the need to look out for whether this child has sickle cell or not. So we start from that point.
But are there families where it's not even there?
Perfect.
Yes.
The other scenario is what happens in majority of the cases where you've never heard about anyone in your lineage having sickle cell, and then you are faced with a challenge in your child for the first time. And how would you know in such a case?
Yes.
So when children are born, and as they approach around the 6 months of age, there are changes in their hemoglobin from the one that they had when they are in the womb to the one they should have outside the womb when they are born.
Okay.
So the one they have is called fetal hemoglobin, and outside they tend to have the normal hemoglobin. So as they approach the month of 6 months, that's when the signs usually first manifest. They may present with either episodes of anemia, meaning that they have a low blood level of hemoglobin.
Okay.
And so when you go to this facility, the doctor or clinician tells you, it seems your child has
low blood.
Low
has
blood.
little blood.
Yes. So one of the things you should think about at that moment is what could be causing it. Could it be sickle cell amongst other things?
Okay.
But then the other major presentation is that usually children present with swelling of the hands and the feet without any incident of injury. And what some parents may think is that probably the helpers at home, the house helps, could have maybe hurt these children while they are away. Okay?
They were beating the satrap.
Yes, or the child could have.
House girls, eh?
Perfect, perfect.
But so the hands and the legs are swollen. Is it the hands, or I think they used to tell us it's the joints?
The hands.
Basically the hands.
Yeah, the hands, fingers, and the feet and toes.
Why is it the hands are not anywhere else?
Okay, the hands and the feet have small vessels. They are called end arteries. And sickle cell, by the way, presents with blockage of the small vessels due to this abnormal hemoglobin in the red blood cells under certain conditions. So when you have a blockage occurring where you have the end vessels, the ends of the vessels, you will have changes, pain and swelling will happen.
Very interesting. So painful swelling of the hands and legs are some of the features, in addition to having little blood.
Perfect. The other features include, like Madam Tracy has mentioned, they may present with yellow eyes, which we call jaundice. They may present with stunting or growth challenges. When they are thin or they are not growing, normally according to the age, they are not catching up with the age-appropriate growth.
Oh, okay.
Yeah, and then the different pains in the different parts of the body, which is the hallmark of the disease.
The pains.
Yes, pains, without any injury. And later on, we shall understand what really happens.
So, if I can summarize, as saying these the red cells, which are sick, begin to block. They may affect the small vessels.
Yes.
So the small vessels are usually at the end, maybe like in the hands, the legs. It cannot be in any other organ. It's just that they are very small and you can't see them. But commonly in children, you would see swollen legs or very painful, legs, hands and feet. Sometimes I think it affects the knee. It can literally affect any organ. Right?
But specifically, it's called hand and foot syndrome, because it usually has a predilection. It goes for the hands and the feet.
Okay, so those
are
the
first symptom.
So those are some of the signs to help you identify that possibly your child could be having sickle cell disease. The next question is, so what does a parent do, Madam Tracy? If they call you, they're like, I think my child has, or they're watching the show and they said swollen legs, swollen feet, my child has it. What do you tell them?
I immediately tell you, do not conclude that they have sickle cells.
Okay.
You have to first go and test. Go test the child, because some diseases have the same symptoms and signs. So before you conclude, you don't parents know how to self-diagnose. Okay, now I heard of folic acid on TV. I heard of Hydroxyurea. They start, coming up with their own kind of treatment. But before you start anything, if you think this child has this, please go to the doctor. Come to our office, BMK House Hotel Africana. We will take a sickle test. But still, I will recommend to go and do an electrophoresis test. It is that.
Are those the types of tests to diagnose?
Yeah. Okay. This is a sickle test. It's just a field test.
It's
I
like
test
a
screening
test.
Yes, thank you.
Okay.
And then if I find you, if I find that you have traces of sickle cell, I'll tell you to go and do a confirmatory test that is done in hospitals, big hospitals, Mulago. Like now, Lancet here does. I think it does this test as well.
I think most of the hospitals.
Now I think
do them.
So,
Yes.
So I tell you immediately, go see a doctor. You come with the results. Then we talk about sickle cell, so that you understand what sickle cell is. Because most times this will just give you results, and they might not really give you a lot of time to explain this. Now that is where I come in. After you've come with your results, we sit down and start understanding sickle cell anemia.
Sickle cell. So step one,
Yes.
recognize the signs.
Thank you.
Which are the poor growth, the pains in the arms, the legs, the yellow eyes, little blood. Step two, seek help and get a test done. You said the first step is the sickling test.
It might be a sickling test, but
Sickling test, the screening test.
Yeah, screening test. But if you come to my office direct, well, of course I'll give you a screening test so that the parents and daddy, mommy know that, okay, I'm a carrier, because most of them, they even do not know that they are carriers.
You also test the parents?
Oh, I test the whole family.
The whole family?
The whole family. But for this sick child in particular who has the signs and symptoms, I will recommend to go and do a confirmatory
test.
Yeah,
and then we'll look for Dr. Kassiri.
Oh, of course, they always do.
Yes,
there is no other doctors.
All right.
Yeah.
So this is just part one of this series of this interview. We are discussing sickle cell. You can see it's quite a big disease, and there's a lot we haven't yet covered. We've just reached the step of when your child is finally diagnosed with sickle cell. We say it is when you have a positive. Is it interpreted as positive, doctor? The HB electrophoresis test. What does it look like?
Yeah, it would come out as a positive test in the case of sickle cell.
But in this sense, it's measuring those genes. I think the gene components in the hemoglobin. So when it says it is AA, that is the double A, indicating the two genes, the genetic parts of the hemoglobin. That is a normal test.
Yes.
So that means
You're normal.
That
normal.
means you do not have sickle cell.
Yes.
Perfect.
Sure.
If it comes as SS, and you said SS is
This is
Double.
the double abnormal gene.
Yes.
And that means you have sickle cell.
Perfect.
disease or anemia.
Sickle cell disease, of the real disease.
Yes.
Okay. And if you have AS, because you can have a combination of half the normal, half the abnormal, that equals the carrier.
Perfect.
All right.
You are watching the Doctalk Show. You are watching the Doctalk Show.
By names of Nantongo Mariam Bazira, a mother Tumbazira Fadhira. By the time I knew she was a sickler, she was 2 years and a half. She first got cough for 3 days, kept quiet without talking. I ran to the nearby hospital, St. Stephen's Hospital. They said she was anemic. Transfused her with 2 units at first. The following day, they said the HB was still very low. So they had to rush us to Mulago. Reaching at Mulago, we spent there 3 months. 1 month, she was in coma. The rest was on oxygen. We spent there those 3 months. They discharged us. We came back home. We struggled because by the time we were discharged, she had lost sight. She could not talk, could not walk, or even stand and sit. We struggled a lot. We gave it time with prayers. The first thing she regained was talking. After talking, it took her some good months. Then she regained the sight, not completely, a bit of it. She could see some things, others she could not see. We had to go to hospitals to check with the eyes, but they could tell us that the girl is still young. We wait. We give it time. So we could only give vitamins. With the vitamins, after some time, like 6 months, she could now see other things she could not see at first. The journey still went on. From the eyes, we now started walking. We started walking a bit. Then we started walking completely, but without the sight. She can see everything except in the book. She can write her names in the book, though she can't write following the margins in the book. That is where we are now. This journey has interrupted a lot. At first, she's so expensive. She has to eat well. She has to drink every time. She has to take some medicine, which is expensive. And besides that, as parents, when she became sick, we lost our jobs. Me as a teacher, I could not teach leaving her. I got very many opportunities, but they were very far. So I could not leave her. But I thank God. I have 1 career and 2 are okay. To those planning to make families, I emphasize them whenever they go to the hospitals to check for HIV, let them check for sickle cell. Because if they don't check for sickle cell, one could be a carrier and another one a carrier, then they get married. The end result could be producing a sickler, which sickler is very expensive. My fellow parents with sicklers, I always pray that they become strong. With the prayers, and when you become strong, that is how you can manage to take care of these kids. I know they are so stressing. My appeal to the government, since they now launched a drug that is good and best for these kids, let them avail it to the clinic. Because you go to the clinic, they say it is done for the whole week. Then a child misses that drug for the whole week. So we parents with the sicklers, most times we get challenges. We get people who advise us to give these kids herbals. leaving the medicines we are given from the clinics. Those people selling those herbs say if you give them these herbs, she's going to be well completely. She's no longer going to be a sickler, which is very wrong. If you give too much of the herbs to these kids, it is going instead to damage the liver. So it's like you're adding other sicknesses to the kid. She already has sickle cell, you're adding other sicknesses. But most times what we do, we give them herbs, supplementing with the medicines from the clinic. I can't say we don't give. We only give those medicine like avocado leaves for the blood. We give them guava leaves because we are told when you cook guava with avocado, those guava leaves, they improve the immunity, they boost the immunity of the kid. But we have to give very little of it. Not giving it to the kid because she's going to get healed of sickle cell. No. Supplementing the folic acid. We are looking for blood.
You are watching the Doctalk Show.
Good afternoon, viewers. My name is Sarah Chibirige. I work with Hotel Africana and a member to the Sickle Cell Rescue Foundation. We are screening every Wednesdays at BMK House. We have an office there. We don't converge considering the pandemic going on, but people come in one by one. We do the screening. We do the counseling. For people who are going to get married, it's very important. It's just like another HIV. You understand? In fact, personally, I take it, sickle cell, you need counseling before marriage than what? Than even HIV, I would say. Because you're bringing in a child into this world who will suffer this disease but does not know. But at least if you know your status before you get into this marriage, probably you can look at what to take on and what not to take on. And so we are continuing to sensitize, to counsel, and to test at our offices at BMK House. The message I have to the public: test. One, once you're going to get married, please test. And those ones who already have warriors, children that are fighting, it is not the end. Because you find that initially the public or people used to have this feeling or belief that once a child has sickle cell, they reach at a certain age and they die at that age. But it's not the case. We have people in our foundation, we have members who are 50 years or above. So it is about the care that you give this child and the love. Please don't hide them. They can go to school. Just explain to the teachers that my child is this and this. My child will need water in the class, even if the class is going on. You understand? Then also teach the child, this is what you should do. If this medicine, you need to take it maybe when you're at school, immediately after your break or your lunch, please take this medicine. Or if at all there is a nurse at school, take the medicine to the school and give it to the nurse to make sure that the child does not miss out on the dose. Call upon everyone out there to take part in the fight against sickle cell. Parents who have warriors, it is not the end. Take good care of these children. Keep them hydrated. And people who are looking forward to getting married, go for testing and know your status before you are in this.
You are watching the Doctalk Show.
Your role as a community member in helping to support a family or someone who has sickle cell disease. So I want to thank you very much, Dr. Kasire Philip, for taking us through that medical description of sickle cell.
Thank you.
And Ms. Nagawa Tracy for highlighting the wonderful efforts of the foundation, raising awareness about sickle cell disease. As we conclude, do you want to give any final remarks? I know we're coming back next week, but any parting remarks before we return?
I want to encourage everyone out there, before you get married, please, I don't want you to come to our offices or go to Dr. Kasure when you are in those I'm going to get married next week, I'm going to get married this. Please do this test in your initial stages of your relationship.
When they even single,
because it makes you make informed decisions earlier. If that is, if maybe both of you are found carriers, or maybe one of you is a carrier and the other. So we get to help you understand this better when you have a lot of time. But when you're in those stages of marriage or have kids, you're in panic and you don't, yes. So it's quite difficult, but and challenging. So I encourage the public, I encourage them, in this month, please frequent my office at Hotel Africana BMK House, first floor. Every first Wednesday of the month and the last Wednesday of the month, we do free sickle cell test.
Could you say that again? When do you do the free test?
Every month, every first Wednesday and the last Wednesday of the month. The other times of every month.
So whether it is January, the first Wednesday and the last Wednesday of January, any month, the first and last Wednesdays, they will do free testing. You've had that.
And
so look for this
charge.
office. Very free of charge, and can help you get wonderful insight into the genetic background of your family. Sure. And Dr. Kasire, I know we'll come back next week.
Yes.
But so final words.
Thank you very much. Sickle cell concerns all of us, and we should care to test and link patients into care. And the other thing is that most of the government facilities across the country also offer these tests. And we know we have a central public health laboratory that coordinates all this and also offers the service free of charge. So if you're unable to come to the city confines, you can go to the nearby public hospital health facility to access this service. Thank you.
All right, thank you very much, our guests, for the evening. We'll see you next week for part 2 of the sickle cell series. Remember, the month of September is a commemoration of the efforts in fighting sickle cell disease, and therefore you should engage your family, engage your community members in supporting people who might be suffering from sickle cell, or getting your family tested so that you can know whether you have sickle cell disease in the family or not. We'll see you next week. If you have any questions, please send them on our social media platforms. They're always open. And don't go away. We'll catch you next week. Goodbye for now.
Qualified, professional, and compassionate doctors talking real solutions to real health problems.
The month of September is the Sickle Cell Awareness Month. It's the month where experts raise awareness and give valuable information as regards this disease called sickle cell anemia. You're welcome to the second part, the second series of this interview with our sickle cell experts in studio. We have Dr. Kasire Philip, who is a senior pediatrician at Mulago National Referral Hospital and the head of the sickle cell clinic. Welcome back to the show,
Thank
Dr.
you.
Philip.
Thank you, Dr. Darius.
Yes, and
hello,
on
viewers.
and on his immediate right is the executive director of the Uganda Sickle Cell Rescue Foundation, Ms. Nagawa Tracy. Welcome back for this second series. Yes, I know just last week we were talking about sickle cell and the roles of the foundation in supporting, as you call it, warriors, the children who are living with sickle cell disease. And we talked about the diagnosis and how it's important for when the child recognizes the signs of sickle cell, they first go and get tested before even concluding that they have sickle cell. You need to first get tested. So you go and get tested, and thereafter, when it's confirmed, what happens thereafter? How to take care of a child, there are two parts to it. There's taking care of the child at home, and then there's taking care of the child within a hospital setting. So I think the hospital setting obviously will go to our expert, Dr. Kasiria. So Dr. Kasiria, let's imagine a situation where the mother, the parents, have just learned that their child has sickle cell disease, and now they have come to you in the hospital. What will happen to them? I know there'll be a lot of anxiety, there'll be uncertainty. Now what next? Are there operations? Are there treatments? So what happens next when you've just told the family that their child has sickle cell disease?
Thank you very much. Just to reiterate what you had earlier mentioned, is that the single most important thing to do is to have a test that will confirm whether the child has sickle cell disease or not. And so the next step, important step, is to link this patient or this child into care. Okay? Not hiding at home. So you have to get the courage to go to your pediatrician, your physician, to have that interaction on what ways forward you have for this child or this individual. And when they present to us, first of all, before I mention that, I go to that, sickle cell disease, we've appreciated that it's a disease one is born with and by and large lives with throughout their lifetime. Okay?
It's just part of them.
Exactly.
It's a genetic makeup.
Exactly.
Okay.
And so one of the critical things to do is for you, the parent or the significant other, to accept after the test that this child has this challenge and take the next step of faith and take this patient or this warrior to the physician, to the pediatrician,
to the expert in
to
sickle
the expert.
cell. Okay.
Okay.
So they come to Malago, or they go to
there are several across.
Or they go to any. You said any hospital.
Yes.
Can manage sickle cell.
Yes, I know the ministry is in the process of ensuring that the sickle cell care services are strengthened across the country. Unfortunately, we have regional referral hospitals, we have district hospitals. So all doctors ideally are informed and should have a starting point in as far as sickle cell care is concerned.
Interesting. So regarding specific treatments,
Yes.
is there a cure for sickle cell? That I think that would be the golden question.
Exactly.
Parents want to know, can the child be cured?
Exactly, like earlier mentioned, it's a lifelong challenge that our dear ones will live with. That implies that there is no definite cure within our means in Uganda.
Within our means. So there is a
in
cure
Uganda
outside.
per se. I don't want to stress on the cure which is far out of reach, which is the bone marrow transplant, and all that also has its own challenges and risks. I want people to appreciate that there are treatments that can be given to our children, our dear ones with sickle cell disease, that will improve the quality of life that they have. And these are obtained through a chronic care setting, such as a hospital where patients or these individuals regularly come for checkups, and then identification of complications and address of those complications.
Okay, so there are specific treatments which they get in the hospital.
Perfect.
Treatments which can, I think, prevent future attacks of the sickle cell crisis.
Yes.
Treatments which help raise the blood levels, because said their blood levels are always low.
Yes.
And then treatments which treat and prevent infections.
And address those infections or acute challenges that they come with.
Okay, very interesting. So as regards treatment, I know we haven't specifically dived into treatment, so we'll talk about the bone marrow much later on. But so Ms. Tracy, so regards treatment, care for a child at home. Now you come from the community perspective. You're supporting the families. They have come out of hospital.
Yeah.
Now what do they do?
Actually, most of the time, I first encourage them, do what the doctors have told them to do. That is the first thing you always have to encourage. Because if the doctor has given you drugs, told you do this, he has told you go back on this date, I encourage them to be. It's called adherence to drugs. Please take your drugs on time. If you don't do that, even when I tell you this and this and this, you won't change. You want to be better. So please, the first rule is follow the doctor's orders. If he has told you, go
the
back.
Treatment plan.
Thank you, treatment plan. Yes, doctor's orders.
Like,
okay, treatment plan. Follow what he has told you. And he has told you, go back on Monday. Even when the baby is better, take them back on Monday. That is what I encourage them. Okay. Then besides that, I encourage them to take water. You know, everybody knows how water is very, very, very crucial. In sickle cell management, you know, as doctor said the last time, their blood vessels clog. Okay? So when you take lots of water, you prevent that blood from clogging.
It makes the blood
thank you. Okay. So that all is done. Fluids, not
so
very cold.
Thank you. All the time.
All the time. Not cold drinks, but room temperature drinks or warm drinks, so that your body is always hydrated. You have to keep hydrated. That's why last year's conference that we had, we're saying keep hydrated. Keep hydrated. Yes, because we know it's the first, besides the drugs and all that, you need to always drink a lot of water. And then the other thing is eating well. We know it's a very, very, you need
important.
To feed.
What foods?
Yes.
We encourage
we encourage it's not really like we have specific foods, okay, but we encourage them to have a bit of more of veggies, you know, take your proteins on time, take your iron giving foods, those things, so you encourage a balanced diet. Actually.
I think also Dr. Kasia, the medical team also advises on the type of foods.
Yes,
are there specific foods they should avoid?
We do a whole set of counseling to empower the patient to take care of themselves at home, and also take some medication like she's earlier mentioned. So with regard to the type of foods, like she simply stated, it's a balanced diet, and a balanced diet constitutes of the bodybuilding foods, which are the proteins, from largely the different sources that we have: fish, eggs, meat, beans, groundnuts, and all that. We have a wide variety. And then we talk about the energy giving foods like carbohydrates, and then the protective foods. Okay. These are the fruits and vegetables.
Protective. Why are they called protective?
They play a role in boosting the body's immunity. A lot of fruits have vitamin C, vitamin A, and all that, basically.
Okay. So balanced diet.
Yes.
Hydration.
Yes.
Follow the treatment plan that the doctors have given.
Yeah, there's also those nitty-gritties. Please do not put the child in cold weather. When it's raining, please keep them warm. Things like let them not play a lot in the sun or run, or so even when you take them to school, you need to tell the teachers. So you need to be responsible. Take time and talk to wherever is going to live with your child. If it's the maid, educate them on how to manage that child at home. Please, when it's raining, when they're overplaying, please call them, let them drink some water. You know, let them rest a bit.
They can play, but they have to also keep drinking.
Thank you, keep drinking, and also rest so that their body calms down a bit. So it's that management, the few nitty-gritties that parents keep that put their kids back on bed before you know it, because if they run the whole day, before you know it, at the end of the day, my knee, my back, my foot, my everything, everywhere will be paining. But if you manage them and tell them, you know what, honey, go play, but after some time, come take water. Please come and please rest a bit. It's a bit too sunny. Please encourage water. It's a bit too cold. Please go out with your sweater. Even at school, something like that. I know you want to play. I know you want to play basketball, but you know, limited time. You play basketball, but do not overdo it. Do not limit them. Don't limit them to do what they really love.
Playing.
But
just control the circumstances
God control. Yes, please. You play, but you know, take time to calm down. Do not be like anybody else. The normal ones are going to take an hour on the field. No, you don't have that. Thank you.
Drink a bit.
Yes, you love music and drama. You're going to dance. Yes, but then take so they can also have a life like anybody else, but in a moderate kind of way. Let them have fun, but you know, keep it together as a parent. Yes.
You may be wondering why we are talking about drinking a lot. It's because when someone engages a lot in, you know, physical activity, too much sports or whichever activity, name it, dance, the body loses a lot of sweat and we become dehydrated.
True.
So dehydration, when the body has little water in the body, is one of the triggers of a sickle cell crisis, the sickle cell attack. And that's why she's encouraging you. The child can still play. This isn't that children can't play. They can still play, but emphasis is on hydration, to keep drinking, to follow the treatment plans, keep eating fruits, you know, the vegetables, balanced diet. All these will have a protective, additive effect on the child's life. So I think that is the main point.
Yeah,
yes.
true. Yeah.
Okay.
There's a lot to talk about.
There's much more, but at least regards the care for a child
at least, a little things.
Just a bit. Well, we're almost getting there. So after the break, more about the specific treatments and how to address problems, complications which come about. You know, you have to also be aware that your child can easily suffer a complication of sickle cell. So what do you do when, you know, when things start becoming a bit difficult to handle? We'll discuss that after the break. Don't go away. We'll be right back. Send in your questions on our social media platforms. Get a chance to interact with our guests in the studio, and they'll happily answer each and every question that you have. Don't go away. We'll be right back.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Welcome back. Regarding sickle cell, there are specific treatments that a child should be on to ensure that they live to their fullest, to their life's fullest, to the best quality of life. Which treatments are these? Well, our expert, Dr. Kasirye, is going to tell us what treatment he gives the clients who come to his clinic at the Sickle Cell Clinic in Mulago. So, Dr. Kasirye, are there specific treatments that any child with sickle cell should be taking, and why they should be taking that medicine?
Thank you very much. Yes, there are specific treatments, and we call them routine treatments, which are largely preventative or prophylactic treatments. We administer this treatment to prevent adverse events or complications.
Okay.
For example, we give them routine folic acid supplementation. Not that it's folic acid, not iron supplementation.
It is
to try
folic acid.
Yes.
The medicine is folic acid.
Folic acid, not iron supplementation, to try to address the issue of low blood level. Our warriors tend to have a lot of iron in their bodies, so we avoid that and give folic acid, which also participate in the formation of new red blood cells. So folic acid routinely and on a daily basis.
Okay.
The second thing that we give for the under 5s, we give them penicillin medication, which is PenV, to try to prevent the severe forms attributed to certain bacteria that cause pneumonia and other infections. So that's why we give them.
It's a kind of antibiotic.
Yes.
Yeah, how often is it given? Do
So
they take every day?
we administer it daily for as long as they are below 5 years.
Okay.
In addition to that, we also advise for routine immunization as per the Uganda National Expanded Program for Immunization, which is offered freely, free of charge by the government. We also have additional or booster immunization with pneumonia vaccine at intervals. Okay? So those are two aspects. The third one is we try to give medication that would support the prevention of malaria, knowing that malaria is common in our setting, and it also contributes to the lowering of the blood level, in addition to other effects.
So it's like it worsens the effect of the sickle cell.
Perfect.
Yeah. The malaria itself also eats the red blood cells. It destroys the red blood cells. So you have the patient's blood levels now becoming so low.
Yes.
You have sickle cell and you have malaria. So you give treatment to prevent
We
malaria.
give treatments to prevent malaria, but also we encourage our dear ones to employ all those other malaria preventative measures, like sleeping an insecticide-treated bed net, which are also given free of charge
at the clinics, okay,
by the government.
Yes,
the distribution program is, I am made to understand, so ongoing across the country. So, and also do indoor residual spray where possible. So we employ all the malaria preventative measures. And then where there are events, like, for example, sick episodes, they've come in with, let's say, a malaria, or they've come in with a bacterial infection or something like that. So we manage them as appropriate according to the standard guidelines. And by the way, the Ministry of Health has since concluded the issue of coming up with the sickle cell care guidelines.
Okay.
And they are available
for the health workers
yes,
to use.
Yes, they are available by and large. There's one other medicine which is new in our setting. It's called Hydroxyurea. This has to be administered within controlled settings by a specialist, because much as it is good and it's advocated for, it has to be monitored regularly.
So
and
not everyone gets the hydroxyurea?
Not everyone gets hydroxyurea, and even when they are started on hydroxyurea, they have to be monitored to see whether it's the appropriate dosing, whether you need to adjust the dose and prevent the adverse or unwanted effects that it could be associated with.
Very interesting. So the most important medicines the children should be on: folic acid, anti-malarial treatment, and then anti-infection,
the pneumonia preventative medicines.
Treatment.
Yes, please.
Okay, and then some might get the hydroxyurea.
Yes.
Not hydroxyurea.
Hydroxyurea. Yes, please.
People might think it's a COVID thing. So, Ms. Tracy.
Yes.
When it comes to I know there's a medical bit, the treatment, but there are also other issues surrounding the patient, the psychosocial aspects. What should be done to help support the student? It's not good just giving the medicine, say, okay, you go take folic acid and it. They might be having additional psychological issues. So what do you recommend for such?
Of course, there are stages, because if it's a child, of course, I can't talk to a baby or until there may be an appropriate age to understand what I'm actually talking about. So there are different, if it's a teenager, we have social groups, by the way, that we come up with in different areas. Every area that we visit, we make sure we form a group, teenage group,
like every district
mothers group. Yeah, so we follow them up. So, and those are the group that help the mothers that have just gotten to know. I might not be able to go to Gulu every day or every time. So if you have someone there, if you have a group there that can help a mother in Gulu to actually understand the disease and help them psychologically live with it, something like that. Yeah, so that's what we do as the organization. Okay. Wherever we visit, we do community outreaches. I do not leave a community where I identify the families, I get their details, I call them, follow them up. Those that come to my office, to our office, I won't say my office because it's a big...
It's an organization.
Yes, so those that come to our offices, you take their details. It's very, very crucial. They go into your database, call them. We have volunteers, we have counselors all over. We have over 20 counselors that come in on a daily basis. Okay, like in bits. So they call, how are you faring? Those couples that have just gotten to know that I'm a carrier, it does not end there. Yes, it doesn't end there by coming, I got to know that. No. You need to know, because they might sit back home and lay back, and maybe they are tortured, maybe the relationship is breaking up, maybe the family is breaking up. So you need to, because most times when they come in as a group or as a family, the mother may not be able to talk about what she actually feels like. want to talk about, or the man, so they call you separately. Okay, now I have my personal questions. You help them. Have my personal questions. You help them. Those teenagers, as a family, the teenagers also have, oh, my mom is like this, my dad is like this, but I cannot talk about it with my mom. You also get to talk about, you get their own session. So we have people that are experts in that field that help them deal with the situation, because it's not an easy situation.
Yes.
Believe you don't want to know.
And where can they get, how can they access these experts? Where can they find them?
With you, if you're Uganda Sickle Cell Rescue Foundation, of course, we give you all our details. You go home with everyone's number. That is, you go home with the office number. So you call. So we work from Monday to Friday, but there are those calls that come in and, you know, something like that. Just, I know, but we encourage them to call to and I post myself as a marriage. It's not really, but we help them in any way to really cope with the disease. So,
so I think you emphasize the important bit of psychosocial. It's something that mental health, you know, mental health is something many people tend to forget. They'll think about the medical, just the disease. Okay, now I have sickle cell, let me take the folic acid, maybe it will get cured. But no, there might be other issues coming. No, how will you cope with the disease when the child is always in hospital and the bills are accumulating? What are you going to do? That, you know, that torture, that strain it puts in the family. I think that's why
that's why we come in. Yeah, we tell you, no, it will be okay. You're not alone. That's why you tell them you're not alone. That's why we are here to help you get through this. Yeah, we even during COVID, doctor, I think you said people, you know, kids are home, you know, the money situation, someone is calling there, okay, now this is stressing, the man has maybe gone for a week or something. Just believe me, it has not been easy. You are working online, you need to be online all the time. This is sending a message, this one is calling about this issue. Please help me, I need to visit a hospital, I do not have access. And then you be there and tell them, you know what, yes, you're going to do this, so calm down. Tell me what's happening, calm down.
Things will calm down
so
eventually.
It's that language you tell them and be like, okay, fine.
Okay,
you have a neighbor, you go to this neighbor next to you. We have all those connections and people that can, they can reach out to.
That's really good that the foundation is doing that. Now, talking about COVID, Dr. Kasiri, COVID and sickle cell. You'll tell us more, I think, after the break, whether people with sickle cell might be at higher risk of getting COVID. We do not know. But you want to give us useful tips on how to, one, prevent future attacks of sickle cell, prevent yourself from getting recurrent diseases, and you know, since we're in the COVID era, protecting yourself from getting COVID-19 disease. So that is coming after the break. Don't go. We'll be right back. Please stay with us. Send in your questions on our social media platforms, and we'll be with you shortly.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Hi everyone, my name is Diana Atwine, the Permanent Secretary, Ministry of Health, and I'm glad that we are talking about sickle cell. Sickle cell is a big killer of under 5, and we see is one of those causes of morbidity in adults and children. The plan that we have for the Ministry of Health, first of all, is to increase the awareness to the public, because we know that many people actually don't know about this disease, and even those that are sick, some regard it as witchcraft, and you find that they do not seek the right medical attention, and that affects the care, the quality of care, and also the outcome. So one of the plans that we have is to increase the awareness to the public so that people know the importance of testing, of prevention. The sickle cell disease can be prevented if the people intending to marry carry out tests so that they know and they rule out any possibility of them having traits. Traits are silent genetic material that once combined from a man and a wife, you get children that have the sicklers, the real full-blown sicklers. So therefore, this can be prevented by testing before getting married, so that you know that you don't have those traits. Because for sure, that one is clear, it's science. If you have both of you, if you have traits, then you know that you'll have children who have sickle cell. But also those that are unfortunate and they have it and they got children who are sicklers, they also need to know how to take care of them, to ensure that they seek medical care, to avoid conditions that predispose them to the painful crisis, to avoid infections that would predispose them to, especially to loss of becoming anemic. So all those are things that need to be taught to the public. So we are continuously engaging the public for them to know. The second plan is to increase access to care. Now, increasing access to care means that we are ensuring that there are essential medicines available. I am glad now that we have Hydroxyurea medicine available, and we are working with partners to ensure that this medicine is availed to the population out there that need it. The third one is to ensure that we train our health workers to raise that awareness even among our health workers, to be able to detect, even using the simple means, but to detect and suspect, first of all, to suspect the sickle cell, and also to carry out diagnosis, so that we do not lose any opportunity for the sicklers who need care, that they'll be missed. Of course, the challenge has been to budget for individual illness. Sickle cell is another chronic illness like diabetes, like hypertension, like rheumatoid arthritis, like any other chronic illness. Therefore, we have not allocated resources directly that this is for sickle cell, but we have allocated largely the budget for testing, for treatment, like any other illness. So there's no particular budget set apart for sickle cell. But also we want really to scale up the treatment centers where people can be treated. The regional referral hospitals, the general hospitals, the health center force. Also to raise awareness, even the lower units, that they are able to have high index of suspicion, especially in the areas that have high prevalence of sickle cell, such that the simple method of treatment, like malaria, like if they have painful crisis, how do you manage? Because that one you may not have to need to refer. So that really the care is integrated, the services are integrated within our routine care. I know that we have some specialized clinics in Mulago, for example, and even we do some outreaches to test and to have special clinics for sickle cell. But we want this to be integrated in routine for with other diseases, so that it's not just standalone, because we do not have those resources to treat one disease, on the side. The message I leave you, the public, is that sickle cell is not a witchcraft. Sickle cell is a genetic disease, but can be avoided. You can avoid having children with sickle cell if you seek counseling and testing, so that your partner, you and your partner know before you have children. Because when you have children together and you have the traits, then there you will not have prevented. But also, sickle cell is a very debilitating disease, and it has attributed to death of under 5. The biggest contributor of death of under 5 children is sickle cell. Yet, we can avoid it. The other thing I wanted to conclude with is that sickle cell, now because of the advanced technology, we are seeing now bone marrow transplant possible. But in Uganda, we haven't yet started doing the bone marrow transplant, but we are hopeful that by end of this year, if it was not for COVID anyway, we would be able to start to do bone marrow transplant. Unfortunately, the COVID came in, and we have taken over the facility that will be used to do this, to give this service. But we know that government is committed, and we hope that in due course, once we overcome this current crisis we're in, we are going to start seeing, now we have children and old people transfused, but mainly the children, because the outcome is better, to transfuse and to have cure for sickle cell. But for now, the only solution is to be aware of the factors that bring about those attacks, the painful crisis for the sicklers, to ensure that they eat well, to ensure that they avoid infectious conditions that put their lives at danger, and to ensure that they get the support of the family.
You are watching the Doctalk Show. You are watching the Doctalk Show.
So, Dr. Kasiri, before we went for the break, we were talking about COVID-19 and sickle cell disease. Is there any link between the two, and should we be worried?
Thank you very much. Just like we've been advised and probably witnessed COVID to be a global pandemic, it's real, and that concerns all of us, whether you have sickle cell or you don't have sickle cell. We're all at potential risk. What would put our clients, warriors, at more risk is that sometimes they have chest complications. Okay. And therefore, if you brought COVID into the picture, it will potentially worsen
it will not be
the picture, the outcome. Secondly, sometimes they have, already we've talked about the risk of blood clogging, the small vessels. So if you bring in COVID again, knowing that it has also been associated with clogging of vessels or clot formation, so that can potentially, okay? We have not completely understood or examined what COVID could do, but if you look at what sickle cell and what COVID does,
the kind of related,
the combination can potentially be catastrophic.
So what should parents do now?
So just like the government has really stressed, we should all observe the preventative measures, okay, to the bone. And more so for this patient with sickle cell, we should also adhere to the preventative approaches like drinking adequately, like she's mentioned, avoiding extremes of temperature, extreme cold, extreme hot, heat, adhering to the medications, the preventative, the penicillin, the folic acid, the malaria prophylaxis, eating a balanced diet, and then attending your facility or clinic regularly.
So those prevent the sickle cell.
Yes.
Or at least not preventing sickle cell. They improve the
Quality of
livelihood
life,
of someone with sickle cell.
Yes.
So then there's also preventing the COVID, because up now take extra precaution.
Yes.
Wearing face mask,
Yes.
sanitizing, hand washing, social distancing. All these are meant to reduce the risk of getting the COVID disease, reduce the risk of increasing the burden on someone who already has sickle cell disease. We don't want them to get problems with their chest because they already have some other complications. I don't know if we'll have time to talk about it. But we don't want to add more complications on so many other complications. Therefore, it's important we take precaution in preventing ourselves from getting these diseases, such as COVID. It can even be malaria, or it can be any other disease. That's why immunization is important. That's why going for care, for checkups is very important, so that you can live a healthy and normal life.
You are watching the Doctalk Show.
I'm called Wesivade Safina. I'm a student at Islamic University in Uganda, Kampala campus. Currently, I've been working with Red Cross and volunteering with Uganda Sickle Cell Rescue Fund. And sometimes I do some cakes and some art pieces. I got to know about sickle cells when I was 6 years. That's when I realized that I've got an attack, and I was later rushed to Mulago, and I had to be transfused. So when I got transfused, it was still hard on my mom because she used to cry a lot, and I could ask her, like, "Mom, why are you crying?" She could tell me, like, you have sickle cells. But by then I didn't really know what sickle cell was in details. I had no idea. So I was just blank. And then I just moved on with my life. So I went back to school. There is a letter they gave me. I took it to school during primary. Like, it involved things like I was not supposed to be beaten. I was supposed to be wearing a sweater. Like, I shouldn't go for PE. And then other things involved, like not being stressed generally. So, but then this other social kind of life, like when it happened to getting friends, I wasn't so good at it because I was often being discriminated at school, because most of them were asking themselves, why isn't she getting punishments? Little did they know that I was a sickler. I couldn't get beaten or something like that. So they used to hate me for that, and they used not to play with me, which I was fine with it because I had a friend called Sarah. She could be there with me. We could pray, like she could do my homework sometimes when I get sick, because I often had attacks and I was taken to the hospital. But then later on they taught my mom, my sisters on how to handle me when I get the pains, like at home. And they used to put hot water on me. Like they get a towel, they soak it in hot water, and then they put an area where there is pain specifically. They could give me some tablets, then they could cover me. And life at secondary, it was not easy was so tough. I want to advise youth out there, if you really want to be like me, because I'm a proud sickler, please avoid drugs, avoid early pregnancies, and please take your spouses for testing.
You are watching the Doctalk Show.
But at least they go into this knowing what they're getting into.
Thank you.
It's better when you know something than when you don't know and start having
Thank you.
regrets
Yes.
much later on in
Thank
life.
you.
At least you start knowing the future could be this. The future could be good or
that.
bad.
Yeah,
Better
sure.
than not knowing.
No,
Not
the,
being
the
in
worst
that
part,
known.
no.
Yeah.
Most of the parents they did not know. They got to know when they have a child, and that's a challenge.
It's a bit of a
Yes.
challenge. Okay, Dr. Kasiri, I know sickle cell is quite a big disease. You see lots of complications. Are there complications parents should be watching out for, and what they should do if they identify it?
Okay. Thank you very much. Like earlier mentioned, one of the earliest complication or common complication is when they have low blood level. And the parent can actually contribute to getting to know this by looking at the inner part of the eye. So they can
under the eyelid.
under the eyelid. So when it looks pale outside the usual one,
The usual is supposed to be
pink.
a nice pink.
Should be pink, a nice
You know,
pink.
like can
Not
I say
hot
dark
pink, but a nice pink.
baby pink.
Yes.
They call it baby pink. Eh?
Yes.
Okay. But there should be some color under the eyelid.
Exactly. So when it looks paler than that,
Or maybe you could even compare with the other children.
yes.
Compare with maybe someone else at home and see, do they look the same?
And sometimes parents actually see their children appearing lighter than usual. So that should be one of the telltale signs. For the older children, they may even say that they feel the heart beating faster. So that should draw attention to the fact that the child may have a drop in their normal blood level. The other complications, critical complications, any chest pain or changes in the breathing, when the child starts struggling with breathing, that's a very severe complication
And they
of
should
sickle
run to
cell. They should
hospital.
urgently run to a hospital setting. And the third complication is stroke, which manifests overtly in weakness on one side of the body, either involving the hand or the upper limb and the leg.
The legs. Eh?
However, we advise our parents to our dear warriors to be keen. Sometimes it presents in a very subtle way, where with changes in school performance, for example, arithmetic, you find your child suddenly deteriorating, all in language. So those subtle changes may be the early signs of an impending stroke. So if we catch it at that moment and do the necessary treatments, it may actually prevent or even reverse the stroke event.
There's even an abbreviation called FAST for stroke.
Yes.
F meaning the face, you see the child, maybe ask them to smile and see one side of the face, the smile is not good.
Okay.
That can be one sign, that is
Yes.
the F. Then the A is the weakness. Maybe they have a difficulty. One hand is not weaker than the other, they cannot lift things properly. Maybe if it's the writing hand, suddenly the handwriting has changed.
Yes, please.
Something
Yes.
like that. Then the S is the speech.
Yes.
You see in the speech has changed a bit. It's like as if they are, what is the, it's
Yeah,
not as
slurred.
it used to be. It's
Yeah.
a bit slurred, in a way.
Yes.
So that is the FAS.
Yes.
Then the T is the time.
Yes.
Yes, I think that mnemonic first can help parents quickly recognize that this child might be getting a stroke.
And quickly seek
And quickly
care.
seek. The T is for
Timely.
the time.
Yes.
It's all about time. Once you realize these things, take the child as soon as possible to the hospital. But otherwise, I want to thank you very much, Dr. Kasiri and Ms. Nagawa, for this enlightening discussion on sickle cell. And in this month of the month of September, being Sickle Cell Awareness Month, we appreciate you taking the time off your busy schedules to come and educate all Ugandans about sickle cell. As we conclude, any parting words? We always like to give parting words. Those last tips, the key message you want which one viewers to remember Was that you?
Yeah, really.
Miss Tracy. Yes.
It's September. Well, we are making noise for sickle cell, and I want to encourage people, please test for sickle cell. It is a very dangerous disease. We want to reduce cases of sickle cell. How? We test, we get to know, so that we avoid having these children come into existence. So please,
just test.
Please, and if you know, if you're already there, please, it's not only just to make the noise. Now you've had the information, you know what sickle cell is. Please preach the gospel,
others.
preach the gospel, preach the gospel. The more we work together, the more the world gets to know, the more we fight for sickle cell, the more lives are better for the ones that already have the disease. So please make noise. Come to our offices at BMK House and get more information. We are always there Monday to Friday. We work from 8 to 5. Please feel free to always walk in the office and ask any question about sickle cell, and we will be able to give you every and each information that you need. And the other thing is, I want to thank our sponsors, Board of Director, BMK Group, Hotel Africana, Roofing. I want to thank AGT, and above all, I want to thank you for this opportunity.
Yes.
This is a wonderful opportunity for allowing me to talk about this issue.
Yes, and we also appreciate you and the Sickle Cell Rescue Foundation for what's most important for us is health dissemination, health prevention. So when you come out to educate people about this disease, it really creates buzz. Thank you, Tracy. So, Doctor, any
the key thing is that we need to care about sickle cell, and therefore care to know our status as well as those around us, and care to link our children to care, because it does help. Thank you so much.
Care for yourself, care for your children, care for your future.
And your
future
neighbors.
Children. All right, so you heard it from the guest today. September is a Sickle Cell Awareness Month. You've listened to the experts in the field, and they've told you everything about sickle cell, the do's and the don'ts, all those tips. Make sure you adhere to this advice, and you could possibly save. you could help a family that is suffering from this, that's struggling with this condition, and help them live a much better life. So thank you very much, our guest doctors, and we'll see you next time on the Doctalk Show. Remember, you can send in your questions on our social media platforms. We'll be so happy to hear from you. As for now, till next time, goodbye.